So I'm pleased to present to you former Governor of Vermont, Howard Lee.
Who are your biotech clients? Your biotech clients, who are they?
I worked for McKenna a long day at biotech clients.
Did you get what you wanted for
Just
them in this
a moment,
bill?
sir.
This is a corrupt deal. Why was single payer taken off the table?
Just
Why? This is a totally corrupt deal, and you're part of the problem. You're totally part of. You have biotech clients. You portray yourself as a spokesperson for the people. You said in an op-ed in the Washington Post that this bill ought to be defeated.
I hate to interrupt.
I hate to interrupt. You say you're for single payer, and you're not. Nobody lifted a finger for single payer. Not one finger.
Get out of here.
I'm not going to get out of here.
Will you leave?
45,000 people die every year because of lack of health insurance, and you're a biotech ship. I will.
Now will you leave the room? Now will you leave the room? Thank you very much.
$100 billion more a year in subsidies and forced purchases of a corrupt insurance policy. And there's no way for consumers to protect themselves. There's nothing in this bill, for example, that prevents insurance companies from continuing to deny care when doctors recommend it. You know, there's one state that requires the insurance companies to report when they deny care. That's California. 20% of the time when a doctor recommends health treatments, the insurance companies say no. And there's nothing in this bill that changes that, yet Americans will be forced to buy this corrupt, flawed product. And the biggest, you said that was unnecessary, you're right, it's unnecessary, but not only is it unnecessary, it is disastrous for the Congress, it's disastrous for health care. It's disastrous to this Congress because, as you point out, this Congress is not capable of regulating insurance. Is that going to change when you have hundreds of billions of dollars a year more going to the insurance industry? How much of that hundreds of billions of dollars a year is going to be kicked back to members of Congress in campaign donations? How many tens of millions of dollars a year are members of the Congress going to get from these corrupt insurance executives and vice presidents donating to their campaigns? And now with Citizens United, with the fear of these corrupt insurance companies spending money to keep people out of office or get people out of office, how can we expect ever to see real reform if this bill passes? This bill is a disaster, and I'm sad to see that you're on the wrong side of it. And I hope you'll actually rethink your position and come back out the other way, because there's no way with this bill passing that we are going to see good health care in the United States. We're going to see insurance domination of Congress, insurance domination of consumers, insurance domination of doctors and nurses. Already insurance companies make $11 million a year CEO average salary. Why should some poor person, and that's who's going to be forced to buy insurance in this, the working poor, why should some poor person spend 8% of their income, as is in these bills, to fund the CEO salaries at $11 million? They can't even make ends meet. They can't even put food on the table. You're talking about 90% of African-American kids in this country are going to be on food stamps at some point in their life, and now they're being forced to buy corrupt corporate products. This is a charade, and it's been a charade from the outset. President Obama, at his first town hall meeting, the first speaker was the insurance company, the last speaker was the insurance company. If this is a disaster for the Democrats, it's Obama's making. And it's sad to see a former head of the Democratic Party going along with that.
Anyway, here's the fundamental disagreement that I have with the Single Payer Act, because I'm not against the single payer. What I'm for is letting people choose for themselves. The fundamental disagreement I have with those single payer advocates who believe we have to put everybody in the single payer system is, what Americans really want is choice. They do not, we're essentially a libertarian country. Libertarians are not just on the right with tea bags hanging from their hats. They're also on the left. I just had lunch with Alan Grayson, who's a terrific guy who actually has a Medicare buy-in bill, which I couldn't plug for. We know that in the past. But he also is a libertarian in the sense that nobody in America likes the government telling them what to do. So given that people want choices, I believe that if you give them real choices and you make those choices fair, that they will vote with their feet and reform the system themselves. The reforms will come because people make choices, not because we tell them they have to reform. But this debate is a respectful debate because we desperately need change, and this bill is not it. I'd be the first person to agree with you. The difference we have is, does this bill advance against us or does it not? I think the preponderance is that it does, but we're going to find that out, or not.
May I respond to the choice?
You may, and then I'm going to go to somebody else.
So Americans have been sold for the last year or so on the idea that they want a choice of health insurance, but our experience in talking to the American people is that they truly want a choice of health care provider and a choice of treatment